Mercy Korir will be bringing us that report shortly. On the 18th of March today, social distancing is still a new concept that Kenyans have had to quickly learn and implement if the coronavirus pandemic is to be contained. While the spread of the virus cannot be stopped, experts advise that it can be delayed and contained if everyone plays their part by minimizing person-to-person interaction. So why stay home? Dr. Mercy Korir explains.
We need to be compliant with some of the things that we've been asked to do for the public good that may go against my personal wishes.
These are the habits that Kenyans have had to quickly incorporate into their day-to-day lives to keep the new coronavirus at bay. One of these is the call to stay home and self-quarantine.
If you're quarantined for 14 days, then that gives enough time for everyone to go through the worst part of their infection. So we can try and contain it at household level, and the story ends within a household. And if we didn't do that, then the story becomes, a community problem.
Many who will contract the virus will either show no symptoms or have mild symptoms of cough or fever, which, if they are not vulnerable, their immune system can fight.
But the challenge is, if then you expose those who are more vulnerable, so people over the age of 70, pregnant women, or people with pre-existing conditions, then it becomes a problem. Then the hospitals begin to fill.
Premises such as the Standard Group's headquarters have had to secure their perimeters hygienically by redirecting everyone to hand washing points, sanitizers, and temperature screening. With an additional brief history of travel, the hospitals have not been left behind.
The screening that we are doing is basically, and I need to make this very clear, a temperature check and history to understand whether you need coronavirus testing or not. It was bold to shut down schools, colleges, and some of the bold directives that he has given. But that is going to save many lives.
These measures have been put in place to implement and maintain social distancing to safeguard inpatients and employees who still have to report to work to continue offering essential services. Patients will only be allowed a maximum of 2 visitors at any one time, and children under the age of 12 will not be allowed into the hospital.
It was bold to shut down schools, colleges, and some of the bold directives that he has given, but that is going to save many lives.
This aims at keeping the number of confirmed cases low in order not to shock our health system with a sudden surge of very ill people that it may not adequately manage. Dr. Pamba advises that government should address all communication gaps because in such a pandemic, misinformation causes panic.
It will be imperative that leaders, all leaders in this country, are supported to have the right set of information on this pandemic and commit to communicate that information to any segments of the population that they interact with. The second thing that I would tell the president is that when we come out of this, what will be very clear is his agenda on universal healthcare and his agenda on building climate change resilience for Kenya are both spot on and very timely.
Coronavirus pandemic is not only testing Kenya's health system, but also the people's ability to observe certain public health guidelines like staying at home and maintaining a social distance to keep the virus away. Dr. Mercy Korir, KTN News in Nairobi.
Well, let's now take a quick look at some facts on social distancing. Definitely something to strictly adhere to. Now, with the government